Good day. You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. How you guys doing? Okay. Okay, you're welcome to another edition of my program. What's gonna be today's topic? Today's topic is the most popular demand since last year. Yes, people have been asking for it, and this week it has been crazy. It's one of the biggest problem that we usually have when we talk about mental health. Okay, so let's go right into it. But before I start, have you subscribed to my YouTube channel? My YouTube channel handle is called Health Talk Queen 1, and my TikTok Health Talk Queen, IG Health Talk Queen. If you want me to discuss any topics on health issue, please contact me at www.healthtalkqueen@gmail.com, okay, or slide into my inbox on TikTok, and I'll be willing and happy to answer all your questions at my leisure time. Okay, now let's dive into it. This thing is gonna be part two. It's gonna be 1 and 2. Please watch this one fully and make sure you watch part 2. It's called management of depression. Management of depression. Okay, now I told you my program is just going to be strictly preventive as in nursing perspective. So let's dive into it. What is depression? Depression is a common mental health condition characterized by persistent feeling of sadness, hopelessness, loss of interest or pleasure in activity previously enjoyed. I'm going to go over it again. What is depression? It's a common mental health condition characterized by persistent feeling of sadness, hopelessness, and loss of interest or pleasure in activity previously enjoyed. Now, we've seen when we talk about depression, we have depression in adult and we have depression in children. Okay, so I'm going to be bringing the children perspective one very soon, and the children one is more complicated, but I will try my possible best to bring it. Okay, so now it can happen in any stage of life, both adult, children, old, name it. People can get depressed. But what are the cause? What are the symptoms that you will see and you'll be thinking, okay, am I depressed? So let's go right into the symptom that you will see and you can tell maybe the person is depressed or not. And before I even go that situation, lot of things is happening around the world that can make us depressed. So these symptoms vary from individual. Individual A can have different from individual B, but like I said, it's a mental illness, it's a mental symptom, mental issue that we need to discuss about. So what are the symptoms? Persistent mood or sadness. People with depression, they feel so moody. They are very sad. Loss of interest or pleasure in activities. Let's say they love to watch soccer. All of a sudden, they just change. They don't love soccer anymore. They love to listen to music. All of a sudden, they just change. They don't like to listen to music anymore. The next one is change in appetite or weight gain. So this vary. They can either gain weight because they are eating excessively to stop the depression, or they stop eating and they can lose weight. So it's both way. Sleep disturbance, insomnia, or excessive sleeping. Now, it's either they have lack of sleep or they sleep excessively. So lack of sleep, they don't sleep, which is insomnia, or they sleep excessively. That's why sometimes most of them they end up gaining weight. The next one is fatigue or loss of energy. They just tired, unexplained tiredness. They moody, they cranky, they're sad, they cry unnecessarily. So the next one is difficult in concentration or making decision. Yeah, at that time they can't make decision because they are not in their right sense of mind. Okay, the next one is irritable and agitation. This is common with people with depression. They get irritable. Any little thing, they get so agitated. They are always fighting. If they are not fighting, they are just in their own little corner. That's why you don't mix them with people that are quiet versus people. We have people that are like introvert and extrovert. The introvert, don't mix them with being depressed. No, that is their own nature. But when we talk about these people saying in their own like irritable and agitated, they are just like that. So make sure if you start having those symptoms, it's depression. Feeling of worthless or guilt. Yeah, they feel like whatever they are going through, they are the cause. They feel guilty in their self. They feel like the whole world is upon them. They feel like the whole world is just looking at them. They are just worthless. They feel that's the feeling for people who are depressed. Thought of self-harm and suicide ideation. This is the last stage, the last symptom. They feel like, okay, nobody is listening to me. Nobody is going to help me out. I can't do it by myself. Let me end it. So that ending, because of TikTok, I'll be using Pi. I'll be using Pi. I always say Pi because I don't want TikTok to drop my video, okay? So I'll be using Pi. So they end up pieing themselves because they feel worthless. They feel like, okay, there's no way out. That's it. And it's usually towards the end. Okay? Now, so what are the other causes? What can cause depression? I'm going to use this in perspective of Western world versus Africa. Africa, we know that most of the problem in Africa is the economic situation, right? What is going on in the economy? It's not booming. Everything is just messed up, right? But now, in the Western world, stress, loneliness can cause depression. Stress, too much stress, workload, loneliness, you are just isolated. Isolation, that's another thing. Isolation, bullying, not getting one bearing, because you're changing environment. You're moving from Africa to the Western immigrant. Yeah, those are the issue with Western world. But in Africa, lack of money, lack of job, insecurity, and political issue, which I don't want to discuss. Those are the causes of their own depression. There's no job, no money. But regardless, we all have one thing in common that is the causes, which is stress. Now, for stress management, I have a video on YouTube and also on TikTok that I talk about stress management. You need to watch it because once you can tackle the stress, everything will be under control. So watch that video. It's very, very powerful. I will try and pin it on my TikTok account so that way people can watch it, okay? Stress management. Now, let's go to prevention. Now, before we go to prevention, I would like to make this point when we talk about depression. There are some things you cannot change in life, okay? There are some things you cannot change. It's bound to be like that. But think about it, that if you force yourself into depression, what will be your legacy? What will you gain out of it? Or if you force an individual into depression, what will be your own profit? Those are the things that we want to look at and make sure that we tackle it before it ends up into dangerous things that we cannot reverse back. This thing have to do with mental health, okay? And in my program, I'm not even going to be talking about medication. Yeah, there are some antidepressants that the doctor can prescribe, but I'm not going to be talking about it. I'm going to be talking about a nursing perspective, which is teaching. What can we teach as a nurse to our patient, or what can we educate people out there that can help them to manage their depression? Now, depression is a wild topic. It's a wild topic, and the intervention different from individual because individual have different way of coping. Okay, so now let's go to part 2. Please, if you haven't watch this one so that you can know the sign to watch out, and then let's go to part 2 where we'll be talking about the prevention. And this is where I get excited. Okay, now please watch part 2 for management of depression. Thank you.